Say hello to Waymo, the world's most experienced driver. The Waymo driver is what we call our self-driving technology. It has over a decade of real-world experience and has driven millions of miles. With Waymo One, we can make it safer and easier for you to get around, so you can spend more time doing what you love. And with Waymo Via, the same driver with the same deep experience can also deliver your packages or save you a trip to the dry cleaners. Or if you run a business, Waymo Via can help you transport whatever you need, making sure shipments arrive right when they're supposed to. This is the Waymo driver, a driver that's reimagining transportation for all of us.
Hi, good morning, everyone. Thanks for making time in your day to join our session this morning. A little bit about Kaiser Permanente that I want to share with all of you, just to set some context as I dive into the rest of my presentation. We have over 12.5 million members across 8 states and the District of Columbia. And that's the number of patients, the number of members that we have. We also have over 200,000 employees. So with that, I am on a team called Spark that is involved with innovation at Kaiser Permanente. Within KP, we don't have one organization, one umbrella, one leader for all of innovation. So we don't have like a chief innovation officer. There are a lot of teams all over the country that are involved with innovation. So I'm going to share with you today our contribution to that, what we do, how we contribute to that, and then talk about some of the emerging technologies that we are focusing on in 2021. So the name Spark, whenever I give a presentation, first question we get is, what does Spark stand for? It has to be something. It's capitalized, it's a bunch of words. No, we didn't do anything fancy like that. We chose the word because of this definition, putting something into motion or moving to act. And so how we relate to that is we are putting innovation into motion. We are making something happen. And we are moving to do it very, very quickly. So a spark comes and goes very fast. And that's our intent, is to deliver our work very quickly, make a decision, and then move forward. The vision for our team is to improve the total experience for our members, for our KP staff, for our providers, by rapidly exploring technology to accelerate change. So a couple of key points on this are the who. It's our members, it's our providers, it's other staff. So we are an internal facing organization. We don't do work for outside of KP. Rapidly, meaning get to a decision to move forward with something or not very quickly. So we're not going to take a year or 2 years like some bigger organizations might take around technology deployments. We're going to come up with decisions in a matter of less than 3 months. And then our focus is within technology. There are other groups within KP that focus on non-technical innovation, and we partner with them when needed, but our focus is technology. We do fall under the IT arm of KP. Who we are a small but mighty team. We have 10 people on our team, 10. So obviously we're not going to take care of innovation for 12.5 million members, a couple 100,000 employees. We can't do that all by ourselves. So again, we contribute, but we're not the end all be all. Some of the words on here, all these words really do describe our team very well. 3 that I want to call out: scrappy. So being on a team of 10, you have to be willing to dive in, do lots of things, get out of your comfort zone, and do things that maybe you didn't think, hey, I would never think this is how I'm going to spend my day. And that's one of the great things about my job is every day is different. And even if I have a to-do list of things I want to do, I don't know what's going to come my way. And by the end of the day, what I'm going to get to do. So I enjoy that. Visionary, we try to provide ideas, perspectives, thoughts to people and educate people for things that maybe they didn't think were possible. So we try to show them a different future state, a different future, what we could be, and thinking in a different way from what maybe the company thought around some of the work that we do within technology. And then change catalyst, making change happen. So great that we can come up with these ideas, but can we get them deployed into production? What we do, what our team does, really falls into 4 areas. First, we imagine. We work with our internal business customers to imagine what the possibilities are and what the needs are and what the problems are. So we get together with those groups, we hear them talk about their challenges, and then we immerse ourselves into those challenges. We want to experience those. So we will go to their site. We will put ourselves in that situation as best we can so that we feel it rather than, hey, fill out this form and tell us your problem. We want to actually experience it. So we'll work with them to define what that problem is. And then we explore. We see what's out there in the world, third-party software. We can do our own development as well, and maybe something that we have inside of KP that we just need to use differently. So we look at all kinds of options. De-risk, this can be a really funny word. I wasn't sure when I first heard it that I would use it in Scrabble, but I do now. But really, this is trying to determine what the viability is of the solution that we've come up with for the problem that's been defined. Is this something that, yes, this could really be implemented into our environment and take care of that problem? Too many times in the past, you get an idea to solve a problem and it's all about theory. We actually implement the solution, try it out on a small number of people to then make a stronger case for, yes, this is the solution. And then connecting our group, one of the areas outside of direct work that I get a lot of satisfaction with is putting groups together that hopefully can go on and do great things together. So we talk to a lot of internal organizations and we hear what they're doing, what they're trying to do. And we talk to a lot of internal technical teams as well as third parties. And sometimes there are connections, there are problems, there are solutions that should go together that aren't going to involve our team's work. But it's very satisfying to put those two groups together to see what they can do. And it's equally as satisfying as if we are contributing to that. So our catalog of services, how we do this, I talked about the top 4. I'm not going to go through each of those. I'm going to touch on briefly the bottom 4 categories here to add on to the work that we do. So strategy, we connect to strategies. We're not just out there to find technology, get something deployed, and have it not be used. We need senior level sponsorship, and it has to tie to it some kind of a strategy within Kaiser Permanente. And a good thing about being in this big of an organization is there are plenty of strategies to choose from, but there has to be a connection there. The design, our team can put together the vision of what this could be, whether that's through storyboards, which are animated pictures of what the future world could look like, the future state could look like. What, if we're working with software apps, what should that look like to the user? What could the interaction be? So there's a lot of work that we do up front to make sure that here's what the experience is going to be. Does this sound right? We can provide software development when necessary, because sometimes there just isn't the ideal third party out there in the world to solve the problem. So we will either add on to that or we can develop something ourselves. And then we do use AI and analytics. I know those are two really big buzzwords for 2021, but we can use those to help in any of these areas as well. A little bit more about how we work. This is the methodology, if you will, for how we do the work. It lines up with what I've already talked about, so I'll go through it very quickly. We start by ideating, by coming up with that vision. What is the problem? What needs to be solved? And where do we go from there? The research, market research, we do vendor evaluations, we do technology evaluations, we bring them into our environments. We have a couple of innovation labs that we can do that work in and get feedback from the right people. One big point about this is we are always connecting the solution to the problem. We are not the team that brings the bright, shiny object that we read about in a journal, or that we heard about at a conference, or, hey, my buddy down the street has a brother who has a software company that does something that sounds really cool. We've tried that approach in the past and it did not work for us very well at all. So we take the opposite approach now and start from the business side with the problem, go find the solution. And then trying it out, we have a number of ways that we can do that. So prototyping, proof of technology, proof of concept, pilot, all of these are different terms that basically, what's the sophistication level of the technology as we work to test it? And then what's the number of people that we are testing it with? So prototype, you start with something very, very simple just to get the idea in front of a handful of people. And then from there, it grows into something more sophisticated. And then once we have proven, once we have de-risked, and yes, this should move forward, here's the evidence, here's the proof that we've gathered through this work, then it goes into production and we hand it off to groups who focus on that within Kaiser Permanente. Two additional terms that I want to touch on, successful failure and failing fast. They both use the word fail, which has an incredibly negative connotation in most circles. But we're trying to give a slightly different spin with this work. And these are two terms that we use on a daily basis. So failing fast is coming to some kind of a decision very, very quickly. Again, we're not going to work on our projects for a year, 18 months, 2 years to then decide to deploy it and find out nobody wanted to use it. Within a few weeks, ideally, or maybe a handful of months, like less than 3, we want to come to some kind of a decision. Have we found the right thing to this problem? And if the answer is no, have the courage to say, let's stop, let's cut it here, and we'll go find something else. You need to identify as a team that you're willing to do that. Maybe have somebody that is very open to being that person to make that hard decision. But don't just keep trying to force the square peg into the round hole over and over and over if you've proven that this isn't going to work. And a successful failure, all of our work are learning opportunities that we can share within KP. A successful failure, this particular term, means something that did not ultimately go into production. Don't get me wrong, it's very satisfying when you have something you've worked on, it gets into a production environment, and then I'm a member, maybe I see it actually being used in the way that it was intended, and you know you've made a difference. On the flip side, we do a lot of projects, especially being in innovation, that never get into production. So we try to share those learnings as well. What about it did not work? Was it the problem? Was it the solution? Was it the sophistication of the company? Was it the maturity of the technologies? Was it, hey, we're going through a pandemic and now it's just not the right time? And we try to share those within our team and then within KP, because at some point, especially if we don't put something into production, somebody else is going to try to solve that problem. So don't go through the work that we did. Hopefully we can share that, share those learnings, and allow them to pick up and move forward from there. We do the same thing for those that do go into production, but this is where we really can provide a wealth of knowledge. I know this is an eye chart. I'm not going to stay on this slide very long because my final slides touch on each of these. This is just an example of some additional work that we do. The beginning of every year, the first quarter of every year, we come up with emerging technology trends. Those emerging technologies, those newer technologies, that we think KP should be paying attention to for possible use, not necessarily today, but at some point in the future. A lot of the work that we do is more forward thinking toward 3 years out, 5 years out, 7 years out. And it takes time for the technologies to develop and then for us to figure out how we are going to use it. So the 6 areas that we touched on this year, the first one, or that we thought KP should focus on this year, the first one is remote care. A real simple definition of this is provider, patient are not in the same location. We've gone through this a lot, obviously, in the last year and a half, going through the pandemic, but this was an opportunity even before the pandemic came along. How do we gather vitals from patients without having them come into a facility? What can we do to give a similar experience through a virtual visit as an in-person visit so that people do not have to take significant time out of their day to get to the facility? And how can we make that equally as effective? Also, for the providers, if they have tools in their office that they typically use, can we provide remote versions of that so that they don't have to be in the facility as well? So again, it's patient and provider not being physically together, but they can each be somewhere, wherever they happen to be at that point of their day. Extended reality, we're looking into providing simulated and augmented experiences for probably patients, but we're also looking at what we can do for our provider staff as well. And this is something where we can create a completely new virtual environment, or we can overlay something on top of the real world so it looks different. So these headsets, I'm sure many of you have seen these, you've probably worn them before. These headsets can provide that experience. Again, we're looking at both patients and providers, possibly. A couple of areas that we are diving into a little bit more. We call it remote rehab, tele-rehab, where rehabilitation efforts, the individual, the patient, does not need to come into a Kaiser facility, but instead they can do this at home, and we can find out, are they doing their exercises appropriately, and are they getting the improvements that we are expecting? Another area is just immersive training. This is where we can focus for both the patients as well as the providers, but give them a training experience based on what a future state could look like. The intelligent digital front door. So this is the idea with this is a consistent starting point for all user needs. So I don't have to figure out whatever I need to have done today, whatever interaction I want to have with Kaiser Permanente, I don't have to figure out which app do I use, where do I start, where do I, which technology do I need to be thinking about, which technology do I not have that I need to obtain. The idea is it's the same starting point, and then this guides you to the appropriate app, to the appropriate software, to the appropriate channel, whatever the case might be, and you don't have to worry about that. Digital therapeutics, these are prescribed software solutions that are used to replace, in some cases, or complement existing treatments. So the key here is prescription. So we'll come up with certain software, and the areas that we are looking into using this are around mental health and around chronic care. And for example, somebody who has diabetes, we can prescribe a specific software that we feel can best track how they are doing. Are they improving, or are they having additional issues that they need to talk to their provider with? Precision medicine and genomics, these are terms that have been around for a little while now, but this is still very, very new. The idea around precision medicine is taking it beyond just personalized medicine, but learning enough about me and my body makeup, the genes that make me, to identify risks for conditions I might develop at some point in my life, And then also, what is the best treatment for me? Instead of the one pill fits all, if you will, where we have come up with a treatment for a big population and we've created it for the average. Well, none of us are average, and we all react differently to what we may be receiving. So with that, the idea is to know more about me, know more about my body makeup, know more about what my body responds to then give me a better treatment than for a much bigger population. This can get down to the individual level, but it also could be a very, very small subgroup as well that look the same. And the genomics is the interaction between all genes to make me, me. It's not just a focus on one gene, it is all the genes coming together to make up my gene. And my final slide, the digital twins. This is a digital representation of something physical. It can be something living, like a person or an organ. It could be me, it could be one of my organs, or maybe a bone that I'm having treated if I've broken something. And that's where precision medicine can come into play. Build this digital twin, and then if there are 2 or 3 different ways of treating it, try it out on the digital twin. See what you learn from that, see how that responds before you ever do anything to me. This can also be used on non-living physical items like a building, a facility. So if we're thinking that we want to overhaul a building or change the layout of a particular floor, we can try that out using the digital twin, get feedback on that before we ever step into the building to do something. So, okay, that's my last slide. I'm gonna go to the Q&A for just a second. Let me see if I can find it. Okay, the chat. Oh, yes, I will follow a request in the chat if you will share the slides after. Yes, we will make sure, I'll pass them along. I'll make sure, we'll make sure it gets out to all attendees through email. A loved one recently spent 9 days in Kaiser Santa Clara. I was impressed with the attitudes and support in all aspects of patient care. While this doesn't seem technology related, I had been wondering if any technology had been used to get this to such a high level. Actually, this is an interesting area that I'm working on a project, just starting working on a project right now. We're calling it gamified training. So instead of training being the usual watch a video or maybe read something, we're trying to figure out, probably using some kind of a VR headset, putting together some kind of gamified version of training. So put people into a real world experience. The focus of that group, and how I'm connecting it to this question, is the focus of our initial group is going to be nurses and how they interact with patients. It is a real focus area for the partner facility. We're partnering with the San Jose Medical Center on that. And that is a real focus area for them. So I think there's 2 things. One, technology can support that, but also it takes somebody or a group saying, this is important enough that we want to invest in it in some way. Again, we focus on technology. Hopefully we can support that. But if it's not a technical solution, if there are better ways to do it outside of technology, there are other groups to do that. So it starts with a focus in the organization and then seeing how we could possibly complement that. That's the last question I see. If there are more that show up, I'll be glad to answer those offline. Thank you again for taking time. Thanks again to the City of Mountain View and the Mountain View Chamber of Commerce for this opportunity to share what our team is doing this year. We really do appreciate that. And if everyone could take just a minute to rate this session, it'll do 2 things. One, it gives feedback, obviously, to the event and how to make a better event, but it also gives me feedback that I can take to our team on how we improve our presentations as we get out in the world and give these. So thank you again. Enjoy the rest of the technology showcase.